Welcome back, everyone. Dr. Ken Davis back. And so did you have time to think about our last discussion and talk about what's going on with yourself, or what if there was a way that you could find out what your problem was, and a way that you can do yourself or ask yourself a specific question to find out what the best modality or treatment protocol would be for you? That's what we're going to talk about today, as promised. So, one of the things also I learned was that, especially from a mentor of mine, his name was Dr. Reese, the ML Reese, and he's no longer alive. He passed away in 1992. He lived in Sedan, Kansas, one of the foremost researchers and teachers, not only in the chiropractic profession, but really as a phenomenal developer of vibrational and energetic therapy. Taught me a lot of things. We traveled around the world together. Well, he taught me that we are the sum total of what we know. So, meaning that whatever we have and have acquired in knowledge and information, if we can formulate that in a way and ask a question, very specifically, the way in which we understand that knowledge and information, and the way in which we ask the question is going to give us an answer. But we want to be very clear about the question. Now, for example, I find in my own life with friends, family, patients, that one of the things that I also learned was that when we ask, for example, a why question, a why question is what we refer to as an endless loop question. When you ask a why question, your mind or subconscious mind is like a computer that will give you an answer, even if that answer is not based in reality. Now, if you ask us, well, why do I do this? Or why am I in a terrible relationship? Your subconscious may say, because you're an idiot. Or you're this. But if you ask a better question as to, well, what value or what can I learn from this particular situation or relationship, then your subconscious will always reveal to you the exact answer that you need to have. So you need to become aware of that, how you ask the particular question. Now, one of the ways, getting back to your health and healing and understanding which modalities I mentioned in our last session together. So out there you may have a life-threatening illness that you are presently undergoing alternative or medical intervention. How do you know that's really right for you? Because someone tells you that that's right for you? Or your family tells you? Or the MD with 85 degrees behind his name says this is the way you have to do it? Now, again, it may be we may utilize these individuals in our life, or the universe may utilize them because that's the way in which you're going to be healed, provided healing is meant for you to take place. It's to take place, as I mentioned earlier, that we may not have physical healing until there's spiritual healing. And you have to understand, too, that there are causes as to why we have a physical illness or a mental illness or whatever. And it can be physically based, as we talked about, mentally based or spiritually based. Now, whether or not you believe in the principle of cause and effect, for example, or what is referred to as karma, that principle, which is a universal law and principle, the principle of cause and effect, what you put out, you get back, may be the principle behind why you're not getting better, or why that individual may have passed over or passed on, whether unfortunately it was your child, or someone else's child, or whoever. There are also factors involved with ancestral components or predisposition to illness that is passed along through our genetic makeup from our ancestry. How do we know that that's not the causative factor? Be nice to find out if it was, wouldn't it? We know that genetics is involved in illness. Certainly today they're finding a gene for this, a gene for that, gene for alcoholism, gene for obesity, a gene for this, gene for that. But And there's a lot of great medical work that's going on there, but how do we know that that's the factor? Well, one of the easiest things that we can begin to do to find out what we need is, it's like having a smorgasbord of food on the table. We have a cake, and we have cookies, and we have ice cream, and we have a steak. Which one of those do I need? Well, one of the simplest but most difficult things for people to do is to trust the voice within themselves that is always there. The voice that I call it the meatball story. And the meatball story is, we all go into the delicatessen or the restaurant and we're famished, we want something to eat, and we say, I think I'll have some pasta. Or I'm going to have a meatball sandwich. So we trust that voice says, I'm going to have the meatball sandwich. Or I'm going to have the pasta or the steak. And we eat it, and, that voice is no different than the voice that says, I need to leave this miserable relationship. Or I need to move from New York to Washington, D.C., or to Seattle, or to New Mexico. The voice that says, I need that chemotherapy session. Or I need to go alternative. Or I need both. Or I need this. Or maybe this would work for me. But because it's life-threatening and our life is at stake and maybe giving up a job or a lifestyle, we don't want to trust that voice. But it's easier to eat the meatball. So one of the things that we can begin to do is we can begin to quiet our mind long enough so that we can begin to go to the same voice inside us which talks to us not so much through our mind, through the heart. And we can begin to listen to it. And we can sit quietly and ask the question, what do I need to do in this given situation for my health and well-being? Which of these modalities, what would I best respond to? And trust our initial response. It's really that simple, but so difficult. So I want to leave you with that in this session. I want you this week, or over the next several weeks until we meet again, to begin to take these things in your life that you're questioning and you want to know what you want to do. Or what should I do? Sit quietly, find a quiet place for yourself. Go to your heart, breathe to it. Ask the question, is this the best thing for me to do? Is this the best road? Is this the best modality? Is this the way I need to go? And remember the meatball story. I'll talk to you in about a week.